Welcome back to The Explainer. So today we're diving into a fascinating clinical trial straight out of the World Journal of Hepatology. We're investigating a medical frontier that honestly sounds a bit like science fiction, but it is entirely real. We're talking about how treating the microscopic bacteria in your gut might actually heal a foggy brain. We've got this incredibly rigorous head-to-head scientific trial to look at, which tests two totally different approaches to fixing cognitive decline in patients with severe liver disease. Let's get right into it. Here's our roadmap for this explainer. First, the gut-brain connection, then cirrhosis and hidden brain fog, designing the clinical trial, the trial methodology, analyzing the scientific data, and finally, the future of microbiome therapies.
So, this right here is the core question driving us today. Can a healthy gut actually fix a foggy brain? We're looking at a trial that tests if restoring a healthy microbiome can reverse subtle yet really debilitating cognitive decline in liver patients. It's a massive, bold hypothesis, literally fixing the gut ecosystem to repair neurological function.
All right, Section 1, the gut-brain connection, disruptions and dysbiosis. To really understand the cure, we have to lay the groundwork for why your intestines and your brain are so intimately connected. It's like a complex biological highway. When a patient has cirrhosis, their liver function severely declines, right? And this decline allows a disrupted gut microbiome, a state known scientifically as dysbiosis, to basically run rampant. Without the liver acting as that reliable heavy-duty filter, toxins produced by bad gut bacteria, specifically ammonia, just bypass the liver completely. They travel straight into the bloodstream and eventually hit the brain. This creates systemic inflammation and neuroinflammation, leading directly to these hidden neurological issues we're going to talk about.
Which brings us to Section 2, cirrhosis and hidden brain fog, defining the target.
Before testing any intervention, these researchers had to perfectly define what they were trying to fix. The target disease here is minimal hepatic encephalopathy, or MHE. MHE is basically this covert hidden brain fog. Now, it doesn't put you in a coma, but it causes these really subtle motor and cognitive deficits that just severely impair a patient's quality of life. We're talking messing with sleep, coordination, the ability to focus, and shockingly, this affects anywhere from 30 to 70% of cirrhosis patients. That's a huge chunk of people. Even worse, if you leave it untreated, it has a high risk of progressing to overt encephalopathy, which is a much more dangerous condition. But because the symptoms are so subtle at first, it's incredibly under-recognized in regular clinical practice. Now, to study this really subtle fog, the scientists needed pristine data. I mean, absolute masterclass level scientific method here. To ensure their data was rock solid, they had to isolate their variables using incredibly strict exclusion criteria. They were ruthless about weeding out anything else that might cause cognitive issues: recent alcohol use, psychoactive drugs, recent varicose bleeds, or known psychiatric illnesses. By doing this, they ensured that any brain fog they measured was strictly due to that liver-gut disruption and absolutely nothing else.
Okay, Section 3, designing the clinical trial, the contenders.
This is the really exciting part, where we set up the head-to-head battle. This trial pitted two totally distinct treatments against one another. On one side, you have fecal microbiota transplantation, or FMT. This is an intensive procedure attempting to completely overwrite and restore the gut flora. Patients receive 2 endoscopic infusions of 200 milliliters of healthy donor stool, spaced exactly 1 month apart. Then, on the other side, we have the current standard of care, the lactulose arm. This is a non-absorbable sugar syrup taken orally every single day for 3 months, titrated perfectly so the patient has 2 to 3 soft stools a day, which effectively flushes out the ammonia. So, you've got one major, ecosystem-level reset versus daily, continuous maintenance.
This brilliantly illustrates the 130 patients' journey over a 3-month period, from the baseline screenings and randomization on day 0 to the crucial second FMT session at month 1. Everything builds up to that final assessment and primary outcome measurement at month 3.
Moving on to Section 4, the trial methodology, looking at the microscopic.
Let's look at the rigorous lab methodology they used, because the crucial point here is that the researchers didn't just guess if the microbiome changed, they literally proved it at a microscopic level. They meticulously extracted and sequenced the bacterial DNA from stool samples using these exact steps. First, enzymatic lysis. They used specific enzymes, lysozyme and mutanolizin, to actually break open the bacterial cell walls. Then, DNA precipitation, where they used isopropanol to isolate the raw genetic material. And finally, PCR amplification, where they targeted the V3, V4 regions of the 16S rRNA gene. Think of this specific gene as a biological barcode for bacteria. By sequencing this region, they could definitively identify exactly which bacterial species were thriving and which were dying off.
All right, Section 5. Analyzing the scientific data, results of the head-to-head.
Let's see how this incredible scientific setup translates into actual data for the 122 patients who completed the trial. But before looking at the outcomes, we have to look at the baseline data right here to prove the randomization actually worked. Because if one group was sicker from the start, the whole trial is useless, right? Fortunately, this data proves both groups were nearly identical in age, predominantly male, and had almost identical baseline liver disease severity. They measured this using a MELD score sitting evenly around 13 and 14, so it was an incredibly fair fight.
And here we go, the primary outcome. What is truly remarkable here is the absolute similarity in efficacy. FMT resolved the hidden brain fog in 68.3% of patients, while lactulose resolved it in 66.1%. Statistically speaking, there's no significant difference here. Both treatments successfully lifted that brain fog in roughly 2/3 of all the patients.
Now, what's really interesting about this is seeing the raw objective data. This wasn't just patients saying, hey, I feel a bit better. When tracking the individual components of the psychometric hepatic encephalopathy score, which involves rigorous tasks like digit matching and line tracing, the data shows highly similar steady improvements in psychometric puzzle solving and motor skills across both groups over the entire 3 months.
Going beyond just the cognitive tests, that DNA sequencing methodology we discussed earlier revealed some seriously fascinating insights. Broad microbial diversity didn't massively shift in either group, though FMT patients did show a modest, non-significant increase in diversity. But the key was in the specifics. Over 50% donor engraftment was seen in 19 out of 37 FMT recipients they tested. And the FMT patients who responded beautifully to the treatment, they showed a higher abundance of specific beneficial bacteria like Bifidobacterium. Plus, in a massive win for patient safety, both treatments had very low, entirely comparable rates of severe adverse events.
Finally, Section 6, Future of Microbiome Therapies, the verdict. Let's synthesize all these clinical and microscopic findings. The researchers concluded with this very clear statement. FMT and lactulose have comparable efficacy in improving MHE and health-related quality of life in patients with cirrhosis. Basically, standard daily oral lactulose holds its ground remarkably well against the much more intensive, procedurally heavy 2-session FMT. It's a powerful reminder that sometimes the established, less invasive standard of care is just as effective as the cutting-edge alternative.
So, what should you take away from this whole explainer? I'll leave you with this provocative thought. As we master the scientific approach to mapping the microbiome, learning that specific bugs like Bifidobacterium are directly linked to cognitive repair, perhaps the future isn't about transplanting the entire ecosystem. If a daily sugar syrup works just as well as a full microbiota transplantation, the next frontier is likely precision. How can we engineer next-generation, highly specific probiotics to precisely target the gut-brain axis and clear the fog for good? Thank you so much for exploring the science with me today.